Hello, this is Dr. Vincent Torina again with Orlando Chiropractic. Today we're going to be demonstrating some psoas or hip flexor type stretches. Now hip flexors and the psoas, these are very commonly found to cause low back pain in patients that sit all day long for their jobs, and sometimes you'll get a referral type pain towards the front or towards the groin. Now again today we're going to do a beginner's pose and a more intermediate pose for as you're becoming more and more flexible through the hip flexors. Alright, so the first pose we're going to demonstrate is very commonly done in yoga. This is called pigeon's pose. Brandon here is going to start off on all fours. He's going to take this right leg, tuck it up in front of him, bringing the knee kind of down inwards. He's going to then lean forward over top of that right knee, arms out in front of him, rocking the pelvis parallel. What this is going to do is give a great stretch to this right hip, but more importantly, we're stretching out the left-sided hip flexor. While in this position, Brandon's going to take 3 deep breaths. Good, and then he's going to come on up, and we're going to demonstrate it for the opposite side. So again, from all four, bring the left leg up, tuck that left knee in. He's going to go up over top of that left knee, sticking the legs out, rocking the pelvis forward, parallel to the ground. Again with the 3 deep breaths. This time we're stretching the left hip, but then working on the right-sided hip flexor. Go ahead and come on up to a kneeling position again for me, Brandon. Now this time we're going to go into the more immediate or the more advanced pose to stretching this hip flexor. This one is more of a lunge type movement. Brandon's going to go ahead and go up into a kneeling position, right leg out first in front of him. We're going to take our right leg, put it at about 90-90. We're going to have this back leg slide back just a hair, toes pointed outwards. Brandon's going to then take his right arm, tuck it on the inside of his elbow, or inside of his knee, and then come down. Again, trying to keep the hips parallel with this right knee at 90-90. This puts less stress on the knee. Again, working on this left side hip flexor. He's going to take 3 deep breaths again. Good. Excellent. He's going to come back up. And we're going to go ahead and switch and do the opposite side. So again, knee comes out to 90-90. Right leg comes back, points the toes, brings this elbow onto the inside of his knee, dropping both elbows down. Keeping 90-90 here on the left hip while stretching the right hip flexor again. 3 deep breaths. Good, and he comes on up. If you're not sure if you're having psoas pain or hip flexor type pain, you should definitely come and see your chiropractor.